respiratory system. And then,
Sir.
as said, that every day we'll be learning something. So today we'll be learning two concepts in X-rays. Right? So I put the X-ray also, and we'll see that. So gradually we'll keep on building our knowledge into the radiology also.
Sir.
Yeah.
I have not started with book reading.
You have not started with what?
With reading books, physiology.
So no worries, because in any case, the concepts which we are learning right now, they are spread across so many pages or spread across so many chapters. So no worries. And in fact, the radiology part which we'll be discussing, what I'm trying to prepare is that by the end of, when we say that, okay, today we complete the respiratory system, it should not happen that you should be knowing only the physiology part. You should be knowing the radiology part also very effectively. You should be able to understand so many diseases, their mechanism. So that way, though I'll be putting slightly extra load on you, right? Because you have to learn so many things and you have to really focus. But once you are comfortable with this system, it is the same system which will be followed all the way for all the topics. Mandatory to remember biochemistry after passing biochem exam. Well, regarding the biochemistry thing, as we'll be learning so many pathologies, especially when we'll be learning the immunology. At that point, you will learn the importance of biochemistry. So yes, it is important, but well, for exam purpose, you need to know each and every step very precisely. You need to know very precisely. Well, Ratta Maro, that is like, I never say that. Because once you understand the process, it becomes very easy. It becomes very easy. And some of the cycles, say for example, Crab cycle, so right, it is a fixed cycle. It is a fixed cycle. The steps which are over there, so those steps, there is, so yes, in exam you have to remember it. So I'll show you the best method how to do it. No, all those things, unless you want to go in pathology in future. It is for understanding. It is for understanding. When it comes to medicine, you automatically will find that everything whatsoever you learn is of utmost importance. Okay. See, if you have completed upper limb, as I say, that you go to my channel and simply go to that upper limb playlist and start finishing all the videos one after the other. Once upper limb is complete, yes, you can go ahead with the thorax. But before completing the upper limb, after that, ideally you should go for lower limb. Because when we are discussing the respiratory system, the anatomy part is very minimal. And then when it will come to actually the anatomy part, right? So it is completely different as compared to when we are learning the physiology part. So upper limb, because it is pretty simple. Lower limb, it is like an enlargement. It is the bigger view of the upper limb. The limbs, they are bigger. Upper limb and lower limb. If you have completed upper limb and lower limb, then it is the right time to go for thorax. That's right. There are 12 lectures of upper limb. That's right. That's right. So patiently go for that. Download the PDFs, right, whose link is into that description only. So you, in one shot only, you can download all the PDFs. If you have understood all those 12 lectures very properly, you'll be having very crystal clear idea about the upper limb. Then surely you can go to books, because in books, say for example, BD Chaurasia, right, where the things are given in the form of theory. So then you'll be able to understand it also very effectively. In our lectures, there would be almost, those who have seen, they must have noticed that On every page, there is a dissected image all the way. There are images. Hardly there'll be few pages on which something is written. In Atlas, what happens that say, I'll not say that the atlases are bad, but at times atlases they are studded with. In any of the atlas means every structure is marked, right? Every structure is marked, so it becomes so confusing. Regarding the notes, how to write your own notes. Now for that, this is the best points. Let's say this is one topic. Let's say today's topic, right? Let's say this is today's topic. How to really prepare, how to really learn any of the subject, whether it is medical, whether it is engineering, cybersecurity. You learn the topic today. Once you finish it, once we say today's topic is over, thank you, then go through this particular PDF. Right? Go through this PDF. Once you go through this PDF, read it once or twice till you are satisfied, and then you find that yes, there is no confusion. Shut down and start writing by your own. Start writing the whole by your own. As if you are talking to yourself. As I said, that I'll be teaching you one sleep learning. Right? Sleep learning. I got few emails also. Though I discussed it in very brief, but not in more detail. I'll talk about it. Say, but coming back to this, you have read the PDF twice, thrice, and then once you are satisfied, shut down everything. Take a notebook and start explaining the same topic, to yourself, as if you are talking to yourself. Now you need not speak loudly. That is active recall, right? And then keep writing. Now at one point, if you are stuck, what was the point? Don't worry. You don't go back to that PDF and acha, this was the point. No, finish the topic from first to last. In one of the lecture of mine, where I say that many times people say, start learning this and start learning that. No, never do that. Make this principle. Learn to finish. Yes. Literally, what I'm telling you is the secret of my life. I've always, whatever I start, I try to finish it under any circumstance. Whatever happens, learn to finish. Because it is said that more than 80% of the people, they don't finish what they have started. Everyone starts a very enthusiastic, but very few finish it. And then, once you are over here, add some value to it. Some value. Right? If you do this in any subject, right, you will be surprised by your success. So from today onwards, you follow this method. And then once you are confident, once you are very clear that yes, I've understood the topic very well, all of you have got the smartphone. Start the audio recording. Go at a very slow pace. You don't have to go at a very high pace. Go at a slow pace, but only the keywords. Right? Only keywords. Just speak the keywords. And recording. So just let me finish. Right? So at a slow pace, you speak only the keywords, and then play this file and bindas go to sleep. Don't use the headphones. So it is like you are playing on your phone, and your phone is lying at a distance of about 2-3 feet away. And continue. What happened? Hmm. So just this was the thing that you speak keywords. I'm repeating it. Once you have understood the topic at a slow pace, speak only the keywords. Don't go for lengthy description. Don't go for lengthy description, because once you understood the subject, that every keyword will create a spark in your brain and you will be able to do that much effectively. Play this file when you go to sleep. Next morning, as you wake up, right, as you wake up, play it again. And the logic behind this is playing it again in the morning, because in the morning when you hear some sarasa song, right, absolutely faltu rubbish song, that song, it keeps on playing in your mind for the entire day. I always give the example of that washing powder Nirma, because it was really happening at that time. Right? When I was in MBBS, when we were used to study, we were having only this small transistor which was made by myself only, but there was no money for the case, right? So the entire circuit was lying on the table. So just join two wires and you used to start. Savere uthe, the moment you join, invariably it used to come washing powder Nirma, right? Doodh si safedi Nirma se laye washing powder wali hai. For the whole day, stupidly, right? That washing powder Nirma is playing. You are reading, say systemic lupus erythematosus, right? Autoimmune disorder. And then in the mind, washing powder Nirma, right? This is what used to happen. So same thing. So that means the brain is so effective, it really picks up those keywords. That's why they say that in the morning you do the puja, right? Puja means I'm not talking about that any particular god, anything, whatever you like. But because it calms your mind, and then your performance for the entire day. Kushagra, Kamble, remove the ID name. Why? I mean, why? Means you should be able to just disconnect and you should be able to connect again. Because for me to find it, it take time. There are more than 150. Acha, I'll explain that. I'll explain the base of the Vivo, that's your name. So phone got hanged. Just disconnect it. So if I'll keep on doing this, I won't be able to focus on the work. It's the point. It's it. It's fine. Okay. Glitch in the voice. Is my voice clear to everyone? It's all right. So Galaxy. Yes, there are so many. Yes, it should not be low. No, it should not be low, because here it is showing that here. So this is what it shows. So when I speak anything, if it is coming into yellow zone, so then everything is fine. Right? So even because even if I whisper, so still you should be able to. Chalo, on to Acha. This is for everyone, those who have joined recently or those who are new. Just send a mail. Send a mail at this email address. It is TILLUR Mbbs@gmail.com. Today only, I'll send you the link and where all the previous lectures are there. Okay. So just send a link to me and accordingly. So now for time being, I won't be replying to chat messages. We start with our today's topic. Right? Then whatever the questions are there, I'll take it at the end. Now at the end. Yeah, please. So this is the sleep learning, what I explained, and the easiest method to learn. This is the email address on which you can contact me. Okay. On to our today's topic. Now today we'll be talking about the concepts which are actually sometimes they got very confusing. These are all the pressures, because in respiratory system everything is related to pressure. So how the things are going? Well, that's the lung. Right? We are drawing just one lung from trachea, and here comes, right, it divides. This is the right side. This is the right lung, and then it has got three lobes, upper, middle, and lower, and it keeps on dividing. The last point is the alveoli. Right? It is called as alveoli, and it is the alveoli where there will be the exchange of gas. Right? Oxygen is more to the alveoli, and the carbon dioxide that is more onto the capillaries. CO2 is more into the capillaries, and then there is the simple diffusion where there is gaseous exchange, and that's how the whole thing occurs. But in case of inspiration, that is when we breathe, so air goes in, and the expiration, the air goes out. Basically, it is nothing but the pressure which are getting changed. This is respiration. Respiration is of two types: the quiet respiration and the forced expiration. Forced respiration. So first, we'll discuss about the pressure changes. That what happens when the pressure, how it happens that just the minor movement of muscles and air goes in, and then we don't do anything and air automatically goes out. Because we said that when it is a quiet, last time we talked about it, those who have joined today only, for them, that inspiration, do that. When you do inspiration, so it is active process. Right? But when it is expiration, you just relax, right? And the air will go out. So this is a passive process. Passive process. So here is, we just break the concept into, this is the right lung, that's the left lung. Over here, there would be the heart. Some terminologies. The space which is in between, the space between two lungs, that is what is called as the mediastinum. Mediastinum. Over here, this is the heart. So the area which is above this level, that is called as the superior mediastinum. Superior mediastinum. So obviously rest is superior mediastinum. If you are looking from the side, this is where you have to visualize a bit. If you are looking from the side, so over here, this is the sternum, correct? And this one is this portion, that would be the vertebral column. So that is posterior. The way there is superior and inferior mediastinum, similarly, there would be the anterior, posterior, and the middle mediastinum. There is interior mediastinum. There is posterior mediastinum. This is interior mediastinum, and this is posterior mediastinum. How is it? The heart which is lying just over here, this is the heart. So you can say that heart is into the anterior mediastinum. And then there is like, remember we talked about that arch of aorta. It starts anteriorly and ends posteriorly. Right? So that, if you are looking from the side, this is how the arch of aorta. So it will be starting from anterior mediastinum and then posterior mediastinum. So that's how things will be divided. So it is just the space, right? Mediastinum means space between two lungs. Between two lungs. This thing would be more clear as we'll be discussing the X-rays. You'll be getting a complete visualization of what we are talking about. Now, first, we are talking about some of the important pressures. Few pressures, extremely easy to understand. The first pressure which is coming up is intra-alveolar pressure. No big rocket science. Intra-alveolar pressure. So this is the last unit where the gaseous exchange is occurring. Right? This is the capillary, and here is the oxygen, here is the carbon dioxide, and they are getting exchanged. So this is alveoli. The pressure which is present into this chamber, this alveoli, that small unit, that is the alveolar pressure. So you can say intra-alveolar so that we are very clear about that what exactly are we talking about. But as we proceed, we might just say alveolar pressure. We might just say alveolar pressure as we'll be discussing the pathology and when it comes. So alveolar pressure or intra-alveolar pressure is this, easy. Right? The second part, this is the not the complicated but the most important pressure, and this is intrapleural pressure. If there is any pressure in the entire respiratory system, then it is this pressure. Because if this pressure moves, multiple pathologies start. So much so even death can. So intrapleural pressure, this is a pressure which is between two layers of pleura. I'll explain what this is. See, don't worry. I'll explain all of them. Those who have joined for the first time, then also nothing to worry. Pleura is nothing but covering. Right? Our all important organs, they are covered by some layers. So for the protection. So when it will come to heart, so we'll be calling it a layer which is surrounding the heart. Surrounding means peri, and a heart is cardium, pericardium. So that's why we'll be calling it pericardium. Right? So this is one. Similarly, when it comes to lung, we have got pleura. It is called as the pleura. Now there are two layers. This is the lung. There it is. Let's take it. Right? This is the lung. And this is, let's say, a layer. Right? I'm drawing it bigger for our understanding. As such, it is not that big. It is very thin. And then there is another layer. Right? And then this is the chest wall. This is the chest wall. So let's say these are all cut end of the ribs, because thorax, entire thorax, it is made up of rib cage. Right? So the layer which is present over here, which is near to the chest, it is called as the parietal. It is called as the parietal. And this one, which is near to the organ, and and the layer which is near to the organ, all the organs, they are collectively called as the viscera. Viscera means organs, and so that's why very truly its name is visceral or the visceral pleura. And yes, there is fluid in between. You are right. There would be the fluid in between. Right? Obviously, we'll be calling it pleural fluid. Right? Pleural fluid. So yes, it is present. To understand this, have you ever tried? I know it looks crazy, but all of us do it. All of us do it. say that Tetra Pak, not the can, but the Tetra Pak. Right? Fruities or any of this like that chas or that Tetra Pak in which there is one hole and we just put the straw. I confess I do it like that, right? So and I'm sure you must also do it, right? Initially we drink this thing with sharafa, right? And then what happens as it comes to end, we tilt it and adjust the straw and, right, till the last drop is sucked out. Right? Any one of you do it like that? Okay. So many of you are like, we do it, right? We do it. What happens to this pack? What happens to this pack? As we, right? What happens to this Tetra Pak? Right? The Tetra Pak, it shrinks. Right? It shrinks. And it gets sucked in. It is because that's right. That's right. So when we take the air, right, in the process of that last drop of that fruity, right, it has been taken, but we also take out the air. So when we take out the air, it is the atmospheric pressure which is outside, right? It really shrinks. Right? Got it? Same thing happens. And it's fun, right? Last drop. Over here, this is the pleura, right? This is the pleura. This is having that fluid. And because of that fluid, those two layers, they are not this much apart. They are almost sticking together, but there is very thin layer of fluid. So that fluid, it gives the suction effect. Now, let's see. But one thing is clear, this is like pleura, and the pressure which is over here, we'll be calling it as intrapleural pressure. Right? The pressure, it will be very minor. Right? Yes, it plays a very big role. So this is the intrapleural pressure, which is between two layers of pleura. Done, right? So this is done. Here. Now the third pressure. Now this third pressure is the easiest to understand. The atmospheric pressure or the barometric atmospheric pressure. Atmospheric pressure means surrounding. So our chest, and surrounding the chest, whatever the pressure is, that is the barometric atmospheric pressure. So this is easy. So if you have understood this three, rest of them, they are very easy to understand. On to the fourth pressure. There is a word which is called as the transmural pressure. Transmural pressure. Whenever the word mural comes, that means consider that this is they are talking about the layer. They are talking about some wall. Right? So this is the pressure across. There is a wall in between, and then there is a difference in the pressure on both sides. Atmospheric pressure. Our atmospheric. This third point is barometric or atmospheric. In simple words, even if you forget this, we'll talk about this. Is the barometric means when the mercury is used and we find the pressure. Our surrounding, as you go to the mountains, right? As you go towards the mountain, what happens? Have you heard of that? They say that as you go on the mountains pe kabhi chai achhi nahi banti. You don't get the good tea over there. Right? The tea which you are getting at your home, right? You try to make it at say 20,000 feet. It won't be that good. The reason, as the height increases, the barometric pressure increases. When it decreases, so the water won't be boiling to its 100-degree temperature. 100 degree. As the pressure decreases, the water will start boiling much earlier. So actually that ubli hui typical chai, right, that won't be available. So that's why on mountains, you don't get the good tea. And breathlessness, that depends upon your lung compliance, which we'll be discussing today. And that depends upon that what is your lung capacity. That's why in all good watches, the sports watch, they say about what is your VO2 max. VO2 max. This is a very typical thing. As you exercise, this VO2 max will keep on increasing, and that would be a classical sign that yes, your fitness is. So when we'll be discussing exercise physiology, at that point, we'll be talking about VO2 max because it varies from sports to sports, from muscle to muscle. Right? In simple words, if your VO2 max is good in running, not necessarily it would be good even for swimming, because it is a very conditional. You need to condition your body. That's the reason that when we exercise, we take the dumbbell and then we just do one exercise. Instead of that, if you do the complex exercise in which multiple muscles are involved, it would be much beneficial as compared to a focus to one muscle exercise. So during exercise physiology, all these concepts will be coming in. Coming back to this, so this is the transmural pressure. Whenever we say mural means this is the wall, right? Let's say this is a wall, right? That's a wall. So pressure across this wall, that is what is called as the transmural pressure. Very easy, transmural pressure. So over here, our situation would be slightly different. Over here, our situation would be, here is our alveoli. That's the alveoli. And then there is one outside. This is what? This is our pleural. Pleural pressure. Correct? Pleural pressure. So there is one pressure over here and there is second pressure here. So whether this alveoli will inflate or it will deflate, that depends upon this pressure. So the transmural pressure, one, where this alveolar wall, that is alveolar wall is our, with respect to that we are calculating. So that is what is called as the transpulmonary pressure. Pulmonary pressure, because alveoli is the unit of this pulmonary system. Pulmonary means breathing system, right? Pulmonary pressure. So transpulmonary pressure, when we say, we are becoming more specific that we are talking about the transmural pressure of alveoli or the alveolar pressure. So here is, this is the wall which is in focus. See, this is the wall which is in focus. Right? So to calculate this, what should it be? Pretty easy. The inside pressure minus outside pressure. Inside pressure minus outside pressure. So inside pressure is what? Inside pressure is alveolar pressure, right? Over here, the what we talked about, intra-alveolar pressure. Right? This is one. So inside is intra-alveolar pressure. Now this one minus the pressure which is into the pleural. So that is our second one, right? Intrapleural pressure. So intrapleural pressure. So that is our second. Great. And if this pressure is positive, right? If it's positive, so what would happen? Very simple, if it is positive, so it is A minus B. If it is a positive value, then definitely A is higher. So 5 minus 3 can become plus 2 only if 5 is bigger than 3. True? So it means by this simple logic, can we say when the intra-alveolar pressure is more, so that means it would inflate, right? Inflate. It would inflate. Right? That chamber would inflate. If it is negative, so that means this inside pressure is low, outside pressure is low. But when it is negative, so it would deflate. if you have understood this much, right, you have learned one condition, what is called as the pneumothorax. Pneumothorax. Just
Hello.
which point? -5, -3, -8. Why? There is minus. No. Don't confuse yourself. Because when you say -5, -3, which one is bigger? -5 is bigger or -3 is bigger? -3 is bigger. -3 is bigger. So in that case, when -3 is bigger, so what would happen? You tell me what would happen. When the result is -8, obviously the inside thing is more, there is less pressure, outside is having more pressure. So it will deflate. It will deflate. So let's keep things simple. Okay. But then comes a very wonderful thing. Now it is what? Inflate and deflate. And take a balloon, right? Take a balloon. It is simple. Pull out. Why the balloon is inflating? A simple balloon, right? Why it is inflating? Because when you blow air inside, right, the inside pressure is more as compared to outside pressure. Correct? Outside pressure. So that balloon is inflating. That balloon cool raha because you are blowing air in. So it's inside pressure. This is the pressure inside. This is the pressure outside. Inside pressure is more than outside, so it would inflate. And then you release this balloon, right? Balloon will, right, bhagega. But that balloon will keep on releasing the air because there is a space. The inside pressure is more. The moment you release this air will escape. And because of this, atmospheric pressure will be acting on that. So it will shrink. So that's how the whole thing moves. Simple. So quite logical. If the inside pressure is more, it will swell. If the outside pressure is more, it will shrink. So this is one. The concept which we are now about to understand is, if I straight away write, that it is the intrapleural pressure is always negative. Never ever forget this. The golden sentence for the entire respiratory system. The intrapleural pressure is always negative, because if it is negative, then and then you are surviving. Then and then you can breathe, otherwise one cannot breathe. It is never positive. If it becomes positive only in those cases when the air actually comes into this pleural space and it leads to all those pneumothorax. And if it is locked, then it is tension pneumothorax and person dies. So what does that mean? Two layers. There are two layers, right? And there is a fluid in between, so they will be sticking to each other. And then air, our lungs, what is their habit? Lungs, they will always try to collapse. Just in few minutes, we'll see the reason also that why they try to collapse. But right now, just believe me that lungs will try to collapse and chest will always try to expand. So these are the two layers. Wait. So these are the two layers. When lungs, they are taking it on one side, and the chest, it is taking it to the opposite side. The pressure which is in between, that becomes negative, right? It is when you do this, when you suck, right, from that straw, so the pressure is becoming negative inside it, because inside that tetra pack, correct? So that pressure becomes negative, and that's why everyone is that it is leading to the shrinkage, because it has to decrease from the outside pressure. So this is the reason that this area will be having the negative pressure, and because of negative, it is keeping, the moment you release, right, it will say, won't allow the lungs to collapse, and it won't allow the chest to expand, right? It is this pressure which is keeping both of them into check, right? Because if there is no pressure, so then lungs, they will collapse. If there is no such pressure, chest would expand, right? Unnecessarily chest would expand. This is something what happens in emphysema. In emphysema, person is having huge chest, but he is unable to breathe. He's absolutely breathless. When it comes to this, say for example, when there is collapse, right, collapse of lobe, any of the specific lobe, this is what happens. The pleura has given up, right? And then the lung is shrinks, it becomes smaller in size. So this is the logic behind it. Is over here, we'll be learning all these conditions in depth, but this is the point that this pleural pressure is negative, right? Pleural pressure is negative. Now we go to that calculation again. Which calculation regarding the transmural pressure across the alveoli, or also called as the transpulmonary pressure. Transpulmonary pressure. Transpulmonary pressure. So this is the alveoli, and that's the pleura, right? That's the pleura. So we call this thing as number 2, this as the number 1 pressure. So transpulmonary pressure inside is 1, right? Number 1. And minus, and this is the pressure which is minus pressure number 2. Whatever the values which we keep, right? Let's say inside pressure is just 2, minus the pressure in the alveoli. This alveoli is 2, right? This is alveoli. And the intrapulmonary pressure, because it is negative, whatever the smallest point, just negative 1, but still it will become positive. So that means when it is positive, what would happen? With positive, it would inflate. It would inflate. It would dilate. That's the reason we need to generate the pressure. And then when there is no effort, right, so as soon as there is no effort, then automatically they will be going for the principle of what is called as the recoil. You try to go in solution position, you try to collapse. It is because this is intrapleural pressure. Just we talked about that intrapleural pressure is negative. So that's why this negative, this minus. This minus came from the formula. Right? This minus came from the formula. Getting it? Right? See, this is the formula. Inside pressure minus outside pressure. Outside pressure, that means intrapleural pressure. Intrapleural pressure is negative. Got it? All right. So that means this is what is called as the transpulmonary pressure. It is because of this pressure, alveoli, they are expanded. Right? Alveoli, they don't collapse. Otherwise, all the alveoli, they'll collapse. When they collapse, when the specific region collapses, right? Let's say this is the right lung, and we have got this middle lobe, and if this middle lobe, it collapses, So that means this entire portion will not be going for oxygen carbon dioxide exchange, nothing. Right? Straight away the oxygen level would drop. So that's the vital pressure which is keeping it on. There are so many other reasons also of collapse. We'll talk about that. So this was the transpulmonary pressure. Now let's go one step higher. We are now moving on to say if this is the alveoli. That's the pleural pressure. And then there is chest wall. This one is the chest. This one is the wall which is right now in focus. That's the chest wall. To make it better, we just draw these are the cut ribs. Right? These are the cut ribs. So what would be the pressure across this segment? We just talked about pressure over here. So this was our inside pressure, which was the alveolar pressure. This was our outside pressure. So this was pressure number 1, this is pressure number 2, and this atmospheric pressure, this is pressure number 3. Right? So same formula will be applying. So this will be the pressure which is across the chest wall. The pressure which is across the chest wall. Now for this particular chest wall, this is thorax. So that's why we can very well tell that this is the pressure which is across the thorax. So we'll be naming it transthoracic pressure. Transthoracic pressure. So here pressure inside minus pressure outside. Which one is our inside pressure? Our inside pressure is this, because that's what we are dealing with. That's the pleural pressure. Our pressure into the pleura minus outside pressure, atmospheric pressure, right? So this is atmospheric pressure. The pressure atmospheric, have you heard of? There is something what is called as zero. But there is another term which is called as the absolute zero in terms of temperature, which is minus 273 degrees. Is minus 273. Its importance is into the electromagnetism. That is the superconductivity, the law of superconductivity. Superconductivity. I'll explain that why I'm using this analog. Yeah, minus 273. So this superconductivity, it explains that whenever through the metal, and when the current passes, it goes into the form of electrons. Right? And those electrons, like Bhatakti Atma, right? They will keep on bouncing here, there, right? They'll be hitting each other, and that's how they reach to the opposite side. Right? This is what really happens at the normal temperature, not at superconductivity. Superconductivity, it occurs at minus 273. When things are heated to cool down to this level, this is something which is used in MRI. Right? When you are generating in that much space 1.5 Tesla strength of magnetism, and then there are coils which are actually picking up the signals from the body, right? T1 weighted, T2 weighted. We discuss all these, but coming to this basic concept that at minus 273 degrees centigrade, over here the electrons, they move in absolutely straight line, and on top of it, not one but two, they move in pairs. And this is the reason for everything, that maglev trains to MRI machines to very specific ammunitions, right, which are working on these principles, some very specific rifles, and when those satellite images, they are generated because the quality, it improves multiple fold. The image processing, many of the computers. So this is the principle of superconductivity. Now this is zero. When you tell someone that zero is not zero. It is a specific value. So when we say that our atmospheric pressure, that is 763 millimeter of mercury, that is the normal pressure. When we talk about barometric pressure, so then we consider that, okay, whatever the temperature and whatever the pressure right now is, let's consider it zero. It is considered as zero because you are not feeling it, so we say it's zero. As we down, those who are into swimming, as you go to the base of the swimming pool, right, you will start feeling pressure on your ears. You don't feel that pressure right now, right? So that's why, for the understanding purpose, current barometric pressure is considered as zero, right? There is no pressure. We are just breathing normally. So our pressure is zero. If we go on the mountain, that pressure decreases, right? As we go into the depth, that pressure increases. This is the principle of what is given, what is called Kaysen's disease. This is the principle of Kaysen's disease. It is called as the Kaysen's disease. Kaysen's disease is what? That as you do, if you go for scuba, self-contained underwater breathing apparatus, right? So you have got the entire breathing apparatus and you are taking the oxygen. As you go down, say we don't breathe pure oxygen. We breathe oxygen and the nitrogen also, right? So because pure oxygen is dangerous, right? It is extremely dangerous. So we breathe the nitrogen also because it is a neutral gas. So as we go down, 21% is oxygen. So as we go down, right, it is because of the pressure which is getting exerted by the water, right? And water generates tremendous pressure. This is the reason that there are only few submarines, or there are, say, Nautilus was one of the submarines, that those who can really go at the Marina Trench beach, right, the lowest ocean, and that is where they keep on moving. Not every submarine has got that capability. And in many of the movies, you must have seen that there is a small crack in the submarine and the whole submarine crashes. Right? It is because the outside pressure is in tons. It is in tons. So without a proper suit, if anyone even goes out, he'll be dying, he will be crushed. So if there is, and similarly, the reverse sink in space when there is no atmospheric pressure, so then it is the entire different ball game. So in Kaysen's disease, what really happens, as you go into the depth, the nitrogen, I'll tell you about it. Because, so as you go deep, the nitrogen, it starts getting mixed into the blood. Right? It starts getting mixed into the blood because of the pressure, right? So it will be, and as you go deeper and deeper and deeper, nothing would happen. You'll be breathing comfortably. But then, if one has to come out, right, if you come out very rapidly, right, this nitrogen will start bubbling out. It will bubble out, right? It will bubble out from the skin, right? And person will get all those hemorrhages. And these hemorrhages, so they are outside. The dangerous hemorrhages which will be occurring into the lungs, which will be occurring into the brain. So in case of emergency, if there is any shark attack or anything like that, immediately there is what is called as the decompression chambers. Right? Decompression chamber. Those decompression chambers, immediately that person is put into decompression chamber. So where there is already a pressure, that bubbling stops, and then gradually that pressure is decreased. Otherwise, they have to take a stop at regular interval, so that nitrogen is neutralized, and then they gradually come up. They can't come up fast. Right? Submarine which was going for Titanic was crushed like that. So many. Now, regarding whales, in fact, the most powerful are the dolphins. Right? Dolphins, they never suffer from Kaysen's disease. Reason? Our chest is fixed. I got failed because of this question, right? When I was in 7th standard. The essay was to be written on the fish, and after about half a page, I wrote that dolphins, they never suffer from Kaysen's disease because of their hyperflexible chest. Right? and their ribs, they are extremely motile. So as the pressure changes, as the pressure increases, when they go down, so their chest, they start making that shape in such a way that the pressure inside and outside, it is balanced. So when that thing, so that's why that nitrogen mixing, right, which was to occur, it won't occur. Our chests, they are fixed. We can't make them very big. We can't make them very small, right? There is a very limited motion. While in case of dolphins, right, they can make these changes very rapid, extremely hyperflexible. So whales, dolphins, all those fishes, right? All those who can really go at a very depth and then they can come out very rapidly. It is because of their anatomy. Anyway, coming back to this, so pure oxygen is harmful for our body. Absolutely, bilkul. This is why even the oxygen cylinder, right? They don't just open full oxygen cylinder. It's just a very small, very controlled oxygen is given. There are only few cases when the oxygen is to be given in the form of the compressed oxygen. Right? Compressed oxygen. What we breathe is oxygen and nitrogen both. But in our air, right, there is 70% nitrogen, right, and 21% we have got the oxygen, and rest of the gases, other gases. But this is like 70% nitrogen is compensated. Only in your electric bulb, right? Not in these LED wala bulb, right? Not in these LED. That filament wala bulb, purana. Right? So you must have noticed that if you have experience or if you have done it, then break this shell and then the filament is there and then switch on the light, whoop, instantly it would burn. Right? Instantly it would burn. Reason that this filament, it goes at such high temperature where it can easily burn. But over here inside, why it is not burning? Because there is no oxygen. Right? There is no oxygen. So there is only the nitrogen. There is only nitrogen. Now nitrogen will not allow the burning. So that's why this bulb was glowing, right? But the filament was not burning. So many why pure oxygen is harmful. It is harmful because there is a very big reason. Reason is because it is called as the oxidative reactions. Right? This is what we'll be discussing when we'll be talking about acidosis, alkalosis, etc. Pure oxygen, it is like a toxin. It can really damage the tissue. Right? That tungsten filament wala bulb, purana. What we breathe oxygen, carbon dioxide. Does pure oxygen, it's nascent oxygen. That's right. So coming back to this over here, this is why the barometric, why we did all this katha, X-rays here and at few pages. So that barometric pressure, barometric atmospheric pressure, we consider as 0. That doesn't mean that it is 0, but it is considered 0 because we are breathing at this point. So when we talk about I put 2 X-rays, in fact the same image, one where we'll be understanding everything, and second which you'll be using for the practice. Yeah. So the transthoracic pressure is pleural pressure minus that barometric pressure, barometric atmospheric pressure, which will be considering as minus. So this is pleural pressure. Now comes the final pressure. This is the pressure. What if we consider all the way together. So this is the alveolar. This one is the pleural. This is the chest, right? That's the chest. And we want to calculate the pressure from this to this, the full length pressure. The full length, because this will be the effective pressure. This will be the pressure which will be used for our respiration. And that is what is called as the trans-respiratory pressure, right? Because we are not interested in individual pressure. Yes, we will be interested in that individual pressure when it comes to pathology. That is, if there is any gunshot, if there is any stabbing. But that stabbing was not full stabbing, but that knife came up to this point, and it created a hole, or the bullet was fired, and that bullet, it took a snap. That is, it hit the pleura and it went out. But the hole has been created. And this hole has been created because this is negative pressure. Immediately, air will come inside. When the air will come inside, it means its pressure will become positive. When this pressure becomes positive, and when this pressure becomes positive, it will lead to collapse of the alveoli. As soon as the alveoli collapse, it means there will be more space available, right? The alveoli has collapsed. So now there is more space available, more pressure to collapse still further, right? And the process continues. Still, the lung collapse. Now this thing can occur even in presence of infection, right? In COVID, second wave of COVID, my right lung got collapsed, right? Middle lobe completely collapsed. When I saw the CT scan of mine only, right, I found the complete middle lobe was gone, right? And yes, the oxygen, it drops, and it drops drastically. So this is the reason why we need to move it proper, right? A minor, just minor injury. And how worst would it be? And this is what is called as the pneumothorax. And they say pneumo means what? Pneumo. Pneumo means air. Thorax means thorax. So then, doesn't it sound like funny? Air in the thorax. Air in the thorax. Thorax में तो air ही होनी चाहिए. No, when we say pneumothorax, that means air in the pleural cavity, right? It is the pleural space. This is where the air is coming, and that air is dangerous. In the whole life, air never comes over. Now, this thing can occur because of some ulta reason also. And that is what? What if there is some infection, right? Say, for example, COVID infection. There was no external injury, right? There was no external injury. This is the alveoli, but you must be knowing that this COVID virus, right? It has got specific affinity for the alveoli. So when over here in alveoli, what if it ruptures this alveoli? It breaks this alveoli, and then all the way, it reaches to this pleural cavity. And now when the pleural cavity, that means again the hole has been created. Yahan pe to there is air and air. That air goes into the pleural cavity. This is already negative, right? This pleural cavity is already negative. The moment there is hole, immediately it will suck the air. And that air, when it is sucked, right, it will increase the pressure and it will collapse it. So either from inside if there is any hole, or from the outside there is any puncture, in all cases, when the air goes into that pleural cavity, that is what is called as the pneumothorax. Pneumothorax. And just as we are discussing, I'll add one more thing. The thing what is called as the tension pneumothorax, it is still dangerous. It is extremely dangerous. And if doctor fails to diagnose it, person would die within no time. The principle of Ajgar, Python, the way Python works. And you know how Python works? Python he never bites. Python would wind around the chest. Now let's say Python is round. Yeah, snake. Python. Ajgar, right? We call it Ajgar. Anaconda. Anaconda to the higher version. But basically, in anaconda, though I won't say anaconda because they show everything, right? But Python, what it really does is, first it will squeeze, right? Now, as it is squeezed, it would be difficult to expand the chest. When it is difficult to expand, the breathing would be, right? So some air has gone. But as one does the expiration, as the chest becomes smaller, it tightens it again. So the breathing will become shallow and shallow. And at one point of time, there is no possibility of any expansion and person would suffocate. This is how the python works. And then at its comfortable pace, it would really gradually, slowly, it would swallow the entire object, right? And then the super powerful digestive juices, and they start digesting. So that is how the python really works. Yeah, very smart. So this is the principle. Tension pneumothorax. Tension pneumothorax, it works exactly on that principle. So there is, let's say there is a bullet injury, right? A bullet came and it broke the tissue, right? A small tissue is broken. Now that tissue, unfortunately, it went something like this. Here is the alveolar cavity, this is the pleura, and this is the tissue, right? The tissue which has been broken, right? The broken tissue. And that tissue was like this, right? A flap of tissue is inside. Air goes in when the person tries to breathe out, right? So this air, instead of going out, right, it acts like that tissue acts like a valve. So it locks. Right? Once again, person breathes, more air comes in, and when air tries to go out, it is locked. So gradually tension is increasing. So much so that this pleural cavity is bigger, right? It starts becoming bigger. It starts compressing the lungs. Lungs are compressed because the entire pressure is increased to that level that even the venous return is affected. Right? What is blocking there? This tissue, flap of tissue, which is acting like a valve. Right? So we draw the heart, right? We draw the heart that we say this is the valve, so that blood can come over here, but it cannot return. So same with this tissue, that air goes in, but when it tries to go out, right, it is stopped. It is stopped. And that's how the pressure keeps on increasing. So much so that it will compress the lung, it will force the opposite, or the heart and everything onto the opposite side because it is expanding. So let's say if my right side is having tension pneumothorax, so then it will start expanding the lungs, pushing every structure on the opposite side. Now the heart, it works on the principle. It has got also this pressure center, pressure mechanism. So heart is also beating because when the venous blood is coming, venous blood is having no pressure, at a very low pressure. From top to the blood just falls, right? From superior vena cava, from here the blood just falls. Straight away it falls. There are no valves. It is only the inferior vena cava, it has got valve to push, and then it reaches to the right atrium. So over here, when the blood is falling, but if the pressure is more, so it won't allow that blood to come. Right? So that means there would be the accumulation of blood in the brain and head and neck and brain. So there would be huge swelling, right? Person would start feeling giddy, right? Because if the blood is getting pooled, so that means whatever the pressure arteries will do, but there is already a presence of blood. So the brain would be severely getting hypoxic. And as this increases, so it starts affecting other systems, and inevitably there is death if it is not diagnosed. And what is the treatment? It is so simple. Bluntly, don't even worry about any of the antiseptic procedures. If it is seen, right, and when we'll discuss pneumothorax, I'll show you the real cases. All you need to do is, if it is gloves, so then it is fine. If gloves is not there, don't worry, right? Life is more important. Just push the finger into that hole where the damage is, right? Yes, it looks very weird, but you'll find that tissue, right? You'll find that tissue, just push it, right? And then clear that area. Immediately the air would release and you will hear that you have saved it. Blood-brain barrier is complete. It's totally different. blood-brain barrier is like a barrier, is like a layer. Some of the drugs they can pass through it, some of the drugs they cannot pass through it. This is, we are talking about the pressure. So that is what is called as the tension in the thorax. So this is the reason why we are learning these pressures. Correct? So when we say trans-respiratory pressure, that means we are talking about the pressure which is through and through, right? Trans-respiratory pressure. This means the pressure inside. Pressure inside is what? Pressure inside is our alveolar pressure. Right? See, I use the word alveolar pressure. As such, intraalveolar, but we can very lovingly use it as alveolar pressure too. It's one and the same thing. That I'll write intra also, but minus the atmospheric pressure, right? Outside. So outside pressure is atmospheric pressure. Atmospheric. So that's how these pressures they are calculated. Correct? One very from the Snell, that is one of the very good books, where he has given some sentences. It is like the lungs, right? Lungs, when they are functioning, they are always bigger than their resting state. Our entire body and all organs, all pumps, everywhere, they will try to go to their resting state. So if the lungs, they are like bigger, right? Their resting state is this size. This is the size of its resting state. And if the lungs, they have become bigger, so they will always try to go towards their resting base or their resting size. So lungs, when functioning, they are bigger than the resting size. And the chest, for chest, it is ulta. Chest is smaller than the resting size. Now, what is this resting size? Resting size is, for lungs, so it is quite clear, because there are mechanisms which will try to pull the lung, right, which will try to collapse it. In case of chest, our ribs, they are like springs, right? They will always try to spring out, right? Because they are under tension, right? It is the muscles which are holding them. But otherwise, the ribs, the boom, boom, right? They will try to make it bigger. So when you do open heart surgery, when you cut this sternum, right, you'll find that immediately chest will open up. Quite easily it will open up. Though the retractors are put, but otherwise it will open quite easily. But when you have to really reassemble, when you have to put it, you have to go for metal stitches. Those standards, normal chota stitches, they are of no use. Right? Catgut or those silk stitches, they can't be used. Right? This is what is called as the metal staplers. Literally, stapler, right? Metal, thak. Then it will be able to hold that pressure. Right? This is the proof that why such strong stitches are to be taken. Right? These are the metal staplers. They are done with the machine, right? Through and through the bones, right? And that's how they are punched. Takes quite a long time. Okay. So this is the principle. Now we talk about two characteristics of any of the tissue. Whenever we talk about any of the tissue, this is, though it is important from the lungs perspective, but it will be important for your entire medical career. Whenever you hear across two terms, very beautifully explained, right, in Guyton, what is called as the compliance, but we'll understand within 5 minutes. Right? Compliance versus elastance. Elastance. Now take a wild guess. Elastance, it reminds you of what? Elastic. Elastic. Right? So elastic is, so this is a wire, right? Yeah, exactly. So I'm just talking about this in between. When I stretch right? See, it is trying to come back. Right? When I stretch, it is trying to come back. The ability to return to original position is called as elasticity. Right? So elastance means ability to return. That is what is called as elasticity, right? Elastic. So yes, elasticity. So if I talk about that, see, this is that wire protector, right? So if you put it over, so if we stretch it and it goes back to its original position. But what about this wire, right? This is also having elasticity. It can be stretched, but we release it, goes back to that original state. But what about this pen? If we pull, right, it is not moving. Right? It is not moving. So, but then there would be certain substances. If you pull them, they'll not go back to their original state. So that means they are less elastic. So if the ability to return back is more, so we say that the elastance is high. Correct? High elastance. That means they are super flexible. Aram se, they will be going back to their original position. This is one. Now we go to the compliance. Compliance is nothing but it is the unit or it is the measure of stretchability. Stretchability. How much you can really stretch. Whether it will be coming back or not, don't worry about it. Can you stretch it? Right? Can you stretch it? So yes. So then if you can stretch it more, so then it is highly compliant. So their compliance is higher. So if you can stretch more, there is increased stretching. Increased stretching. Whether it will be coming back, don't know. Right? They both are independent. Not returning to original state is plasticity. No. Don't confuse the words. Don't add anything extra. Don't add anything extra word because these are the only two words which will be used in all the diseases. Right? Because if I'll go into the plasticity, unnecessary will be adding the things which are related to physics and it has got nothing to do with our tissues. Right? Tissues rely on the elastic fiber. These are all collagen fibers. So in histology, we'll see that. But these are the elastic fibers. When in any of the condition, if the elastic fibers are involved, so that means that lung will become, right? It won't be able to, say, return back to its original state. Right? वो वहीं पे पड़ा रहे. So they won't be able to come back. If they cannot come back, so that means that Python value, right? It has expanded, but it is not returning back. That means if it is not returning back, so that breathing is affected. When the respiration is affected, then oxygen, carbon dioxide transfer affected. Entire body is affected. Point to understand is that compliance is the measure of stretchability. How much can you stretch? Simple. Right? How much can you stretch? Now to understand this, now see, this is that wristband. Okay. So over here, if this is the full thickness, and as I stretch, right, I can stretch it, right? So this thing can be stretched, right? This thing can be stretched. So this is called as compliance. Now, what if I make it double? If I make it double or fourfold, right? I made it like this. And now when I try to stretch, right, it is not stretching to that level, correct? It is not stretching. See, because it has become thick. So if the wall becomes thick, now see, if the wall has become thick and as I'm trying to stretch it, it is not getting stretched. As compared to if I open it and then stretch, see how easily it is getting stretched. Right? So the point what I'm trying to explain is that if the wall becomes thicker, right, if the wall becomes thick, what would happen to its stretchability? It will decrease as compared to the wall, which is, so I'll just draw this like this, right? The wall has become thick as compared to the wall, which is thin wall, right? So thick wall, there is decrease in stretch, right? Decrease stretchability. So that means decreased compliance. Compliance, in simple words, it is the ability to stretch. How much can you stretch? How much can you stretch? So is this point clear? Right? And so whenever there will be thickening of the walls in any of the condition, when the wall is thickened, so that means that lung won't be able to expand to that level, because it will be requiring extra effort to stretch it. And that is what is called as the compliance. So compliance is what compliance is. Increase in volume, right? When we stretch this thing, so there is increase in volume. Now, the whole thing is increasing. So increase in volume increase at same pressure. So how to explain? Again, taking the same example. Let's say I'm generating the pressure of 2 kilograms. So it is getting this much stretched, right? And then if the wall becomes thicker, the wall has become thicker. And now I'm trying to stretch. So if I put the same pressure, 2 kilograms, so then will I be able to stretch more or I'll be able to stretch less? Understanding the question? The amount of pressure which is applied over here, utna hi pressure when the wall is thickened, I apply. How much can I stretch? Less, na? Less, that's right, less. Perfect answer. Make a habit of answering, even if not. So till now, to everyone is understood. So clear? This is compliance. So for compliance, increase volume, keeping the same pressure. It is thick. We need more power to increase, and that is what is called as the elastance. Exactly. So now we talk about the elastance. Yes, you talked about elastance, but that is true. So let's see the color. Increase elastance means ability to return. It is ability to return. That's the elastance. So over here, this is stretched and then it is coming back. But when the wall is thickened, so it will be generating reverse pressure also that high. It is exactly like, have you heard of those exercise bands, right? Exercise bands. So one band, which is like, it is written like, say, 10 pounds, right? So you generate the pressure of 10 pounds, it will be expanded. Resistance band, that's right, resistance band, true. And then there is another band which is of 25 pounds. So you will require more pressure, but when you release attack, right, instantly it will come back. Because its elastance is high. Its ability to come back is high. So over there, when the thickness increases, there is increase in the elastance. Right? Increase in the elastance. And when it is thin, so then there is increased compliance, but there is decreased elastance. Got it? Great. So this is the thing. So over here, how do we define? So the way we define the compliance over here, that it is the increase in the volume at the same pressure. So over here, in case of elastance, how shall we be describing? We shall describe it like that there is increase in what you wrote, right? Increase in pressure for the same volume. So this is, right, increase in pressure for same volume. Let's see. Again, coming back to this. Right? Over here, we want to expand it this much. So less pressure is needed, right? Less pressure. And very true. And when I want to expand this, I have to generate more pressure to take it to that level. This is the principle of those resistant band. 10 kilogram of resistant band and 30 kilogram of resistant band. If you, from 10 inches, you want to make it 15 inches. So the amount of pressure which you have to generate for 10 kilogram band, right? It would be much more in 30 kilogram band because it is thicker. So it is requiring more power, more pressure. More pressure is needed. So there is elastance. So again, what you said is, this is true that compliance is inversely proportional to elastance. If you have understood this Brahma Vakya, trust me, learning multiple diseases, so many pulmonary diseases, it will become like a child's play. But this, you understand it very well. All the things what we discussed. Now we come to our compliance. Compliance is ability to stretch. Simple. This. How much can you stretch? Right? How much can you stretch? The measure of stretching. Kitna stretch ho sakta hai? How much it can stretch. That's the measure. That's the unit of stretchability. So if the wall is thin, right? Wall is thin, it is stretchable. And without retaining. It has got nothing to do with retaining. It is not asking. They both are independent units, but inversely proportional. And if the wall is thickened, so see, to stretch you require more power, right? More power. That's the reason that when tissues cannot stretch, so there would be less surface area available for the oxygen carbon dioxide transfer. If they stretch, there is a bigger area where the oxygen carbon dioxide transfer, gas exchange can occur. Now we talk about just two principles of radiology. And we'll see that thing in the next. The first principle, we use X-ray, right? You'll find that, okay, X-ray chest. And it will be written like X-ray chest PA. X-ray chest PA. This PA is postero-anterior. So postero-anterior means what? This is telling the direction of the X-ray beam. Right? Direction of X-ray. So X-ray beam that comes out of the X-ray machine. So let's draw it over here. So here is our X-ray machine. Right? From this, the X-ray beam is coming out. And here is the patient. And how the patient will be there? Right? This is the X-ray film. Right? This is the X-ray film. This one. And the patient would be standing like this. So here is the X-ray film. And the beam, the X-ray beam, that will be coming from my back, right? So I'm here, that's the head, right? This is the anterior one, and that's the X-ray plate. This is my posterior side, this is the anterior side. So X-ray beam is entering in me from the posterior aspect and it is coming from the anterior. and then it is striking the X-ray plate. So whenever it will be written like X-ray chest PA view, that means understand that this is from the posterior to anterior. In most of the cases, it is this view which is taken, PA view. Why? Just in a minute. That would be our second topic for the second topic. Second point. So this is the PA view. In which cases would you like to take AP view? Right? You will answer this question after we discuss the second part. So we are just putting the query. Because after understanding that importance of PA view, you would say that one should never go for AP. That's true, 100% right. The second point is, whenever you want to diagnose anything, you don't want the things to be enlarged, magnified, right? You want it is of the original size. Right? Means what? For diagnosis, object means whatever you want to see in the X-ray. Object should be having two characteristics. It should be sharp, right? Clearly defined, not the blurred. Because if it is blurred, we won't be able to figure out. Sharp and unmagnified. We want that it should be of the real size, original size. Otherwise, on X-ray, the heart is looking bigger, but in reality, the heart is normal. So then we'll feel like that, okay, there is cardiac. No, we want it unmagnified, as near as to its original size, because then it becomes much easier. This is the screen, right? Here is a torch. Here is a torch. I put my finger over here, right? And its image would be displayed on the screen. It will be of the same size, it will be of the smaller size, or it will be of the increased size. Image would be falling large, increased, large. Okay, good. So this is object 1, and object 1 is getting represented over here in large size. Big, true. What should be done if I say, no, the size should be almost same? So what if I take my hand over here near? Now what would happen? That's right. As we go towards the screen to get original size, it will be of the same size, right? As it is absolutely near to the screen, it will be of the same size. Perfect. Okay. Now comes our sideways. When, let's say, this is my sternum, that's my heart, that's the vertebra. So when the heart is over here, so my lungs are also on the anterior side only. Lungs are also over here. This is the heart, everything is there. So that means the area in which I'm interested in, they are anteriorly situated. True. So if they are anteriorly situated, won't it make sense that if I put the X-ray plate, let the X-ray beam be fired from the posterior side, and it will create the image on the screen, right? On the screen, and this heart would be exactly of the same size as of my heart. Same size, right? So it means if I'm keeping my heart near the plate, it won't be magnified. And if it is not magnified, then that means it will be seen sharp, so that I will be able to see all the things very clearly. That's the reason we are going for PA view. Perfect, right? X-ray chest PA view. So this is the foundation. Whenever you want to take any of that. Now let's say if I've got any problem in the back, my spine. The moment it is like spine, what would be the thing? We'll say go for X-ray dorsal spine. Dorsal spine means thoracic spine, right? Dorsal spine or the thoracic spine. Thoracic spine. And which view will it be? view. X-ray chest was PA view. Which view will this be? AP, not AV. AP, I think was type. Right? AP. AP. Because now the spine would be near. So X-ray beams coming from anterior side going towards the back, right? Going towards the back, and then the X-ray plate is over there and it is generating the, I understand. And then it is hitting the plate, right? So that spine is seen clearly. That's the thing, right? X-ray chase PA view or AP. Now tell me, coming back to this question, if you have understood this both the principles, then will I be ordering anytime X-ray chest AP view? Is there anything like X-ray chest AP view? There is X-ray chest. Those who have answered, proud of you. AP view is classically for bedridden person, right? For the bedridden person. So those who are lying in the bed, right? There is some serious emergency, person is unconscious, right? Or bedridden, or those who are into, let's say, ICU. Because person is lying in the ICU, you cannot say, "Chal beta out." Yeah, even if I got disconnected and then got connected again. Am I audible?
Yes, sir. Sir, but we are unable to send you in the chat, message you in the chat.
Really?
Yes, it shows
Try
that you are not there in the meeting.
No, just try again. Try again. I'm getting the messages from Yash, Arya, Vedant, Isya, Ishita. Okay, okay.
No,
ठीक.
sir.
No?
No.
I don't know your name. A. There is only A is written. So I will just say A. Yeah. But at least say you are audible. I can hear. Chalo, no worries. Say X-ray chest. Right? There is like lateral view. Right? The question which you asked, that was super question. Very much. Very nice. Proud of you. There is X-ray chest lateral view. So when you want to differentiate that, say for example, the easiest thing on X-ray chest, right, here is the X-ray chest, and we come across that there is some structure is over. Now this structure, whether it is in anterior, whether it is posterior, and where is it? Right, we don't know. But when we see on the lateral X-ray, we find it here. So we say, "Acha, this is something which is interior," right? Because in the lateral view only we'll be able to see. We couldn't hear that part. Shweta, which part? Which part? Tell me. I'll explain it again. These are very important principles. So just message. Right? I'll explain that part again. So yes, lateral view is there. About lateral, okay. That's what we are talking. That if there is one structure, you find that some pathology is there, right? Whether it is a cavity or it is some mass, space occupying lesion. So how to figure out that where is it? You will see that X-ray chest lateral. In lateral, if you find that same structure is seen over here, so now we can pinpoint that yes, this is into the anterior mediastinum, right? It is into the anterior mediastinum, or it is into the posterior mediastinum. That is something which is near to the vertebra. So that's what, for that purpose, we need to see the lateral X-ray, right? Because lateral X-ray will show you two dimensions. Because X-rays, so when they pass through it, so you are getting a black and white 2D picture. This is a black and white 2D picture. So that's why you need to imagine, visualize a lot of things. But when you are looking at the lateral X-ray, it will give you correlate both of them, and you get the pinpoint idea that where exactly it is. That would not happen in case of, let's say, when you're going for CT scan or MRI. Right? CT scan or MRI. Because in CT scan and MRI, it is a cut section. So it is like you just cut and then you are watching. So you'll be able to pinpoint it very easily. Why PA X-ray is better compared to AP? Because in case of PA, yes, the things which are to be seen, right? Say for example, we want to examine the lungs, we want to examine the heart, right? So they are more near to the plate. So they will be less magnified and they'll be into sharp focus. If they are away, right? When we'll be discussing the X-ray chest, PA, AP, and the lateral, the moment you will see how wonderfully, beautifully the boundaries of heart are seen, right? When we will be watching the X-ray chest AP view, so then heart is away from the plate. You'll find the boundaries, they are a bit blurred. Over here, see, these are called as the bronchovascular markings, BVMs, right? How nicely they are seen. That won't be the case when we'll be taking the other way around. Right? So for back X-ray, you can say that there is nothing like back X-ray. Right? There is nothing like back X-ray. It is like you need to pinpoint for what purpose. You want to go for spine, so then that is called as the X-ray spine. Which spine? Lumbar spine. So yes, lumbar spine, right? Lumbar spine, so they are lower. So you will be taking it lower, but you want to see the spine, keep the spine near the plate. So that means X-ray beam will be entering from the anterior side, it will be coming from the posterior side, and that will be near to the X-ray plate, so it will be in sharp focus. Even the hairline fractures, you'll be able to see clearly. If it is the other way around, so those very fine, faint fractures, they will be blurred, right? Now, if you are experienced, you will be still picking it up, but not easy. Why to strain that, right? Go for the correct view. Now, there is another view which is called as the lordotic. So, in which the X-ray beam it enters. So, here is a patient, X-ray beam enters like this at an oblique angle, right? So, this is classical in case when there is, these are like Pancoast tumor. Pancoast tumor means when the tumor is onto the apex. So, when it is on the apex over here, this is what clavicle, right? Here is the clavicle, right? This is the clavicle. So, you don't want that clavicle should really obstruct the view. So that's why you'll be taking it at an angle in which no other bone is coming in. So that is what is called as the lordotic view or the oblique view. Right? So that's how things are done. Now see, in this X-ray, today you'll be identifying two things. One, the trachea. Marker you must have already seen. That's the left side. Name of the patient was written over here. Though this is a normal X-ray chest, nothing else. Whenever you see the X-ray chest, first thing what you'll be watching is this shadow. This shadow. Always, always, always. This one. This is what? This is air. Name, date. Yes, you'll be name, date, see, location, age, correct, right? So first thing what you will be watching is the trachea. It is called as the tracheal shadow. Tracheal shadow, it is always because of the presence of air, it's dark. If it is center, if it is in center, so you will say there is no mediastinal shift. There is no mediastinal shift because trachea is in center. So that is the first point. It means structure are there. And second, what you will watch is, see, these are the anterior ends. These are all the anterior ends. These ends, as they move further, right, they will be connected to the cartilage. But cartilages, they are not seen, and that's why you are watching all the anterior ends. So the rib all the way from the see, this is the first rib, all the way from the back, and then it is ending over here. See, it is ending over here. See, it is ending over here. So that's how the ribs are. So they are called as the anterior end of ribs. Anterior ribs. End. So that's it for today. This X-ray, right? We keep on repeating every time. We'll be learning something. So within 3 or 4 sessions, you'll be not only identifying all the parts. So this is the gastric bubble, just right? The gastric bubble. This is the air in the stomach. Air in the stomach. And this beautiful density, heavy density that we call of liver. But it's a solid structure. Right? What you are watching over here, these are the dome of diaphragms. All right. So thanks a lot. And I'm saving this file over shelf. Take care. See you soon. Bye. Diaphragm is this. They are called as the dome of diaphragm. Dome of diaphragm. Dome. This is PA. This is. Oh yes, happy weekend to you too. Tomorrow there is a big plan. 25 kilometers. So see you. Bye-bye. Shweta, these are the branches, these are the lung markings. They are called as bronchovascular markings, all of them. We'll discuss. Next time we'll take that. Because there is so much to learn in that. All right. So, yeah.